Unclear abortion laws create confusion. In its current form, the law on abortion in Malawi is far from clear. There is no standalone law regulating access to abortion. Provisions on abortion are found in the Penal Code, where it is criminalised in sections 149 to 151, as well as sections 231 and 243. Abortion is illegal and punishable by a prison sentence of up to 14 years. There is an exception to this provision where surgical intervention is done to preserve life. There is no clarity, however, on what preserving life entails and under what circumstances this would be sufficient. As a result, many instances where continued pregnancies result in serious physical, mental, and psychosocial harm to girls and women are not clearly considered and covered by the law. For example, Malawi records high numbers of rape and sexual assault cases involving young girls, some as young as 10 years old. Many of these girls fall pregnant as a result of the assault, but are unable to obtain a safe abortion because service providers are not sure whether or not they would be allowed to terminate the pregnancy in terms of the law or find themselves facing criminal charges. Malawi has a comprehensive one-stop center system where victims of sexual assault can obtain medical, psychosocial, and legal support. However, this does not include counseling or provision of safe abortion services where it is required. Lighton Mhango, a clinician at the one-stop center at Kamuzu Central Hospital in Lilongwe, says they face a legal hurdle when confronted with cases of pregnant minors whose lives are threatened by the pregnancy.
For minors that are pregnant, for some, it could be that they're in a relationship, and the others are the ones that have just been maybe raped or defiled. So, for those that have been defiled or have been in relationship, we test for pregnancy. When it is positive, we cannot terminate pregnancies here because there's no any law that legalizes abortions. So we schedule them for proper assessment at our obstetric department at KCH, and also schedule them for antenatal care clinics. But the majority of the patients or clients that seek for abortion services here tend to come later with complications of unsafe abortions, and to some minors who come with issues of pregnancy, they face a lot of challenges because their body is not yet mature to cope with the stresses of pregnancy, and even delivery becomes an issue. And most of these will end up having losing their uteruses because they end up having cesarean sections because they are still young, and later develop necrotic uteruses, and eventually having their uteruses removed. So these are some of the challenges that we are facing at One Stop Center for minors who are pregnant and those who have been denied termination of pregnancy because our laws doesn't support that. As a clinical officer and my colleagues in the Department of Obstetrics and Gynecology, our experience is that for the minors that are pregnant, where we anticipate that the outcome might be poor or injurious to the child and even the unborn baby. Our view was that if there could be a law that could be helping these minors that have been defiled and are pregnant to terminate pregnancy, to avoid the future or the anticipated bad outcomes that will bring permanent disabilities or damages to their bodies. We do the same with other women that are pregnant but have other medical conditions that are threatening their life. We terminate pregnancies. So we think this can also assist the minors that are pregnant, and we know for sure that they are likely to have a very bad outcome. So that is our plea, that maybe if you can consider having laws specifically for the minors to be terminating pregnancies, where the medical practitioner feels slight for the minor.
The lack of clarity in the termination of pregnancy has forced some leaders to take the law into their own hands. In Mulanje, faced with a situation where a sexually abused minor's life was at risk, Senior Chief Chikumbo ordered the hospital to terminate the pregnancy.
Nkhani imene ili pano ndi nkhani ya mwana amene anali imeneyo zaka 11, amene munthu wina amamugwiririra, amamudikira akamachoka sukulu kumtenga ndi kumakagona naye, kumuwuza kuti usaulule kwa wina aliyense, ukaulula ndikupha. Anamuonesanso mpeni ndithu kuti amupha. Ndiye mwana uja mwamantha amakagona naye, mmene amagona naye mpaka na ndithu mwana kumpasa mimba, makolo ake osadziwa, chifukwa anali asanamuone kuti mwana wawo watha msinkhu. Zinangochitika mmene zimayenera kukhali ankati momwemo. Ndiye mwana uja ndithu adatenga pathupi, chimene anadabwa makolo, mwana amangogona tsiku lililonse, kumangogona kawiko basi, kumangogona kukhala ofoka, andi moyo wake unali ndithu omvesa chisoni, okhala ngati kuti wadwalika nthenda ina yake yoti mwina yosowa zakudya mthupi mwake. Ndiye makolo ataona chonchi anamtengera ku chipatala cha Mulanje Mission, kumene anati akathandizidwe. Atapita ku chipatala cha Mulanje Mission kuti akathandizidwe, kumene kuja ndi mmene amakampeza kuti ali ndi mimba ya miyezi 2. Ne anauza makolo aja, mwananu ali ndi mimba ya miyezi 2, koma mmene mukuonekera mkatimu mulibe malo oti akhonza kunyamula chinthuchi. Chikamakula chinthuchi, zinthu zifinyika, mwina mapapo zitha kufinyika, mwanayo azamwalira. Ndiye pakanapezeka njira yoti mwina athe kuchosedwa mimba imene. Ndiye iwo anadandaula kwambiri makolo, tithandizeni mutichotsere mimba imeneyi. Ndiye ananena kuti lamulo sili kutilola, kulibe lamulo loti tithe kungochotsa mimba, lamulo sili kutilola. Ndiye makolo anachoka ali okhumudwa kwambiri ku chipatala kuja, anazandipeza ku nyumba kuno kuzandidandaulira, afumu mtithandize, titani ife tazingwa ndi nkhani imeneyi. Ndiye chimene ndinathandize nawo kuti awatero akuti nalemba kalata pona bambo mayi onse akulira kumulirira mwana wawo, ukaona kamwanako kakuoneka ndithu kuti kakudwalika, ndinango auza ndati adikirani ndikuthandizani. Nalemba kalata kwauza kuti mthandizeni mwanayo, mwana ameneyo chonde ngati kuli kumangidwa ndimangidwe ndine, koma mwanayo mthandizeni, mimba imene ichoke, tipulumutse moyo wa mwanayo. Chifukwa ali nkati iyo sitikumudziwa, sitinamuone, ndiye sitingangofika kunena kuti iyayi koma mwana amene iti msunge, iyayi zosatheka. Ndiye kumene kuja anayese andati ngati kungakhala kuti pali milandu, ine ndiyankha milanduyo, ndakutumani mthandizeni mwanayo. Ndiye anamthandizadi, anampasa injection nakutero kupita kunyumba matenda anakayamba. Atayamba matenda anabwerera kuchipatala siku lomwelo usiku. Wapita kuja mimba ija inachoka. Mwanayo anapulumutsidwa. Andi mene ndune nabo ndamene zimachitika zimenezo kamwana kali standard 4. Pano anafika mpaka na standard 8 kulemba mayeso. Anangokhoza sana sankhidwe. Makolo anabwera sikana ujatu ndi uyu amabwera unondionetsa. Nde kwa ine nachiona china chakuti chapulumutsa moyo wa mwana.
However, faced with the predicament of having to get rid of unwanted pregnancies, thousands of young Malawian girls and women turn to unconventional methods. Over and above, reproductive health experts contend that the unsafe abortion issue is one that needs to be urgently addressed.
The issue of unsafe abortion is quite a serious issue in the country. The fact being that unsafe abortion comprises a big chunk of maternal deaths in Malawi. 18% of the maternal deaths in Malawi are due to complications of unsafe abortion. So it's quite a big problem which requires to be addressed. Well, this issue emanates from the fact that 53% of pregnancies are unplanned. Not unwanted, but unplanned. Within the unplanned, there are those which are wanted and unwanted. And also, because of poor antenatal care and other medical problems, we sometimes have spontaneous miscarriages. So you will see that if you will need to put interventions, we need to make sure that a pregnancy is planned and the care is given during that pregnancy. And that means that provision of contraceptive methods is key, and it remains the number one strategy in the directorate in terms of preventing maternal deaths, those from unsafe abortion inclusive. And also we need to give adequate awareness to the communities as regards to the problems of unsafe abortion. And also, as you know, that abortion in Malawi is restricted to one ground where it is offered when the life of the mother is in danger, according to the Malawi's Penal Code. We need possibly to increase the grounds for offering safe abortion care, so that we will in turn prevent unnecessary maternal deaths. It is worth it to note that when a girl or a woman decides to abort, she will go all the way to abort anyway. So if you go into the communities, you will see that the cases of clandestine terminations are high, because even though the legal framework might not be there, but abortions still occur, because unplanned pregnancies are still high and unwanted pregnancies also are part of those.